name is Dr. Daniel Santisteban, and I'm a clinical psychologist at the University of Miami School of Nursing and Health Studies. Today's talk about depression is just one in a series of videos that present information about emotional and behavioral problems that kids and families confront. I hope that you find it useful and that you become interested in exploring videos on other important topics such as parenting strategies, immigration and acculturation related stressors, and how to help your child enjoy good physical health. Today we'll be talking specifically about depression in children and adolescents. Symptoms of depression are hard to detect in youngsters because these are things kids don't typically openly discuss. Boys and girls are equally affected by depression before puberty. However, in adolescence, depression is much more commonly diagnosed in girls than in boys. Some individuals are biologically vulnerable to depression, and you see it run through families. Other children are not particularly vulnerable, but react with depression to serious life events. Depression sometimes exists along with other problems, such as conduct disorder or oppositional defiant disorder. When a child begins to have tantrums or steal, for example, it can become easier to react with anger rather than seeing the depression that's behind that behavior. The conduct problems can help hide or mask the depression and make it more difficult for you to see your child suffering. Although sometimes difficult to detect, there are important warning signs that young adolescents are going through a period of depression. After recognizing the problem, families can be instrumental in helping adolescents handle these feelings more effectively. So what are some of the symptoms that may suggest your child can be suffering from depression? For 2 weeks or longer, your child may seem down, hopeless, or irritable. Your child may lose interest in activities previously enjoyed. Such activities can include hobbies or sports. You may see changes in your child's appetite, either eating much less or much more. When changes in appetite are severe, you may notice a sudden decrease or increase in weight. Your child may have difficulty sleeping or staying asleep. In other individuals, excessive sleeping may be noticed. Your child may show decreased energy, feeling tired or fatigued even without much physical exertion. You may hear or see indicators of feelings of worthlessness, low self-esteem, or feelings of guilt. They may report difficulty concentrating, thinking, and making decisions. They may be more easily distracted or complain of not remembering. You may even notice deterioration in school grades. Most importantly, your child may express thoughts of death, suicide, or even make a suicide attempt. Here are some questions to ask yourselves. Have you noticed any of these symptoms or signs in your child? How long ago did they appear? Has your child made comments about his or her life not being worthwhile, wanting to die, or have they actually made any attempts to injure themselves? These are all symptoms that should be taken very seriously and lead to a consultation with a professional. Now, here are some ways that a family can help a child cope with depression. Children normally strive to connect with others. If parents respond to this need, children develop a more secure attachment and trust. When children and adolescents become depressed, however, they can become very difficult to get along with, and their behaviors can push loved ones away. Sometimes their behavior appears apathetic and lacking in motivation. Parents sometimes can view this attitude as laziness or oppositional behavior, and these perceptions can lead us as parents to be critical. This becomes a vicious cycle because adolescents perceive the parents to be unavailable and non-accepting, making them more angry and irritable and pushing the parents away even more. When these behaviors have taken hold, it becomes crucial to repair the ruptured family bond and reestablish the trust in the relationship. opening the lines of effective communication between parents and adolescents becomes a very important goal. In addition, when adolescents are depressed, they may have difficulty seeing their own behavior problems and their own inability to problem solve. At these times, it becomes particularly important for parents to model effective problem solving for their kids. Here are some points you may want to think about. What sort of stress is your family currently going through? Are there strong economic or family stresses in addition to dealing with an adolescent who is depressed? Do you recall a time that your teenager approached you with his or her problem? What was that like? Now I would like to talk to you a little bit about how treatment can be helpful to you and your family. Counseling can help your family determine how severe the depression is and how intensively we should intervene. Counseling can help your child identify when they become most distressed and what is it that distresses them. What is the trigger that causes the depression? For example, sometimes it may be just being rejected by a friend. Other times it may be feeling lonely. Counseling can help your child understand what behaviors make the depression better, such as communicating with friends or parents, and what might make it worse. Often that means becoming isolated. Counseling can help families repair the ruptures in their relationships so that the child can experience the support and caring of their family more directly. Now I'd like to take a minute to talk to you about medications and the role that they can sometimes play in treatment for depression in children. If after starting counseling, your child's symptoms of depression are considered severe or persistent, that is, not changing with treatment, antidepressant medication may be considered. Certain antidepressant medications can be beneficial to children and adolescents with depression. At the time, there are very few medications that have been approved by the FDA for use in the treatment of depression in children. As with all medical decisions, doctors and families should weigh the risks and benefits of treatment for any individual patient. Those children who are prescribed the medication should receive ongoing medical monitoring. Once started, treatment with depression should not be discontinued abruptly. Although the medications are not habit-forming or addictive in any way, abruptly ending an antidepressant can cause withdrawal symptoms or lead to a relapse. Families should not discontinue treatment without consulting their doctor. Well, I think that's all for this segment on depression. I hope that you found this information helpful, and I invite you to view some of our other material and videos that we have available. Remember, there's no better time than now to give your children a push towards healthy development.